ports and catheter status codes. These are V codes. Also, the question was, what ICD-9 codes are used to report the patient that a patient has a port for receiving medications like antibiotics, chemotherapy, infusions, etc. Not the CPT code for the placement of the port. Also, what ICD-9 codes are used to report catheters, both urinary and cardiac, currently in place. So Sandy, what I did was I went in and let me just highlight that, pull that up real quick for you. Pulled this all out of Find a Code, pretty much. And you have to know that it's a V code, first of all, and then to look these up, you have to have the right keyword to look them up, especially if you're using an electronic, like an encoder versus your manual. But V07 is going to be your first place. This is the key is prophylactic or treatment measures. Okay, so if a person is going to get chemo and that type of thing, what are they getting it for? They're getting it for prophylactic purposes. So V07 is going to be your launching point. Keep in mind, there is certain long-term prophylactic drugs that there's other V codes for, and that's why this is excludes. Okay, and let's just look at what the prophylactic means. A prophylactic is any kind of a preventative measure. A prophylactic may be a medication, drug, device, or treatment designed and used to ward off a disease or other unwanted consequence. And the examples that they're giving is a tetanus shot, antivenom, immunoglobulin, or fluoride to provide protection and prevent a potential condition or disease from developing. Now, they also make a note that prophylactic measures reported within this category do not include the removal of any potential cancerous organs and so on and so forth. This is different. In this category, the V07, we're looking at things like, and one of the choices is chemotherapy, which would be V073, but you're still going to have to add on to that. And here is also some that is V07.51, use of selective estrogen receptor modulators or serums, and these are the different estrogen stuff that they give to women that have like breast cancer, which is treatment. And then you get into what we were talking about in the question with status codes. And whenever you're dealing with somebody that has an artificial opening, that's going to be a V44. So we're talking about an ostomy of any kind. It can be an ileostomy. It can be a colostomy. And again, there's several kinds of ostomies, and you're going to find them in this V44 section. The other one, V45, cardiac devices in situ. So any type of cardiac device that has been added or is being used. V45.1, renal dialysis status. So if a person is getting plugged in for dialysis, this is the area that you're going to find that. Making a point of V45.2, post-procedural status, and that was one which I added because a lot of people don't think of this, presence of a cerebrospinal fluid drainage device, okay, a shunt, a valve, or device in situ. Again, these are anytime that you are putting something into a patient so that they can put things into you or let things come out of you and drain, this is that area that you're going to be looking at. They even have presence of contraceptive devices, and then one, again, that a lot of people forget is available is V45.7, which additional digit, acquired absence of an organ. That would be if a person had a maybe they had their spleen removed because they'd had an automobile accident. If they give you a kidney transplant, they don't actually take out one of the kidneys. They leave them in there. So that's not an acquired absence of an organ. You may not have known that. But 45.86 bariatric surgery status. Again, you can imagine how important this is to be in your record if you go in to have a procedure done, and then they find that you've got a gastric band, or they go to give you medication, or what if they went to pump your stomach because you had ingested something? It's going to be pretty important that they know that you've had bypass surgery. A gastric bypass surgery. V58.6, long-term current drug use. That's where you get long-term insulin use or long-term antibiotic use. V58.62. The last one, and the one that I think gets missed so often, is amputation status, because they abbreviate it, and most of the time I see that in that area that I showed you in that chart, that the patient has the blood pressure and all the vital signs, and then off in the corner it'll say BK, below knee amputation, so it'd be BKA, and you won't, it'll be all caps, and you don't even think about it because it's in the vital signs, but below the knee amputation, and that's a V code, and it also carries an HCC, so it is something that is very important to always be documented, and it affects the care of the patient if they have an amputation, especially a limb. You can have finger amputation, stuff like that, don't carry HCCs, but a lower limb definitely would, and especially if it has something to do with maybe a diabetic manifestation, and then they had an amputation of below the knee or above the knee. So those are the main ones that you need to look for, but your main key terms that you need to know is status, when you're looking up devices and things like this being in a person, and then up here it's prophylactic. If there's some medication or something that's being used on a long-term basis, you're going to find your codes kind of lumped in all in those areas. So I hope that was helpful to you, and you were able to glean how to find those codes from that. V codes can intimidate people, but man, once you get in there and start using them, it starts clicking.
Need more medical certification training? Go to www.codingcertification.org.